I think that any plan that we have has to have prescription drugs as part of it, because that's a bigger and bigger part of healthcare today. And the deal that we need to strike with the drug companies is, look, you're now going to have a whole bunch of new consumers. You've got to cut a better deal for those customers so that they're not 3 months or 6 months into the year suddenly having used up their entire benefit. They can't afford out-of-pocket costs, and they just suffer until they can get back and a new year starts. Now, that is going to be a battle with the drug companies. You know, as I said, to their credit, they've been willing to negotiate. But let's face it, they like making a profit, and the prescription drug plan as currently constituted has been very profitable for them. And they will, you know, there'll be some tough negotiations. But what I want to do is make sure that I'm negotiating on behalf of your patients, your customers. They need help. And one thing that you raised, as we are increasing access, not only are we going to have to make sure that drugs are affordable, we've also got to make sure that there are enough doctors out there, especially in rural communities. And that's one of the reasons why what we've said is, let's make sure that the reimbursement system that we have under Medicare and under these other plans reimburses family physicians, primary care physicians, people who are, you know, doing regular checkups, helping prevent illnesses ahead of time. They are the lifeline for healthcare in a lot of communities, especially rural communities, and we've got to make sure that we are encouraging more and more people to go into that practice. I also want to provide scholarships to medical students to go into these kinds of practices as well. So everybody, you guys have been terrific. I had a wonderful visit, and I apologize to any customers who were trying to shop while we were doing our town hall meeting. But I really enjoyed your time. I hope you got the information you need. Please spread the word to your friends and neighbors, because, as I said before, there's just a lot of misinformation out there. If you have health care, you'll be able to keep it. But we are going to fight and work to make sure that health care inflation goes down, you have better access, better quality, we cover people who currently don't have it, and we make sure that insurance companies are treating you fairly. I think that's a good deal, and we can get it done with your support. Thank you very much, everybody.